This session is one of the breakout sessions, and it is being webcast. So we have the privilege that the other two breakout sessions do not have. And we're going to talk about evolving methods in evaluation science. And what we're going to hear from the three experts is what has happened, what are the new approaches to evaluation science? What are the canons of evaluation science that have evolved over the last couple of years? What are some of the new techniques that are being applied in evaluation? They're the persons who will say, oh, evaluation's as old as the hills. There's nothing new under the hills. But I gather that that is not true. And there's some new approaches to evaluating, especially evaluating large, complex programs that be well worthwhile hearing from our three panelists. The drill is, we are supposed to get out of here by 12:15, we will. And the drill is that each panelist will have up to 15 minutes to speak. Then I would like an interactive discussion, not just a question to the audience. I'm sure some of you have opinions you would like to share, or novel approaches which you would like to advance in terms of evaluation science. So I hope we can have a more interactive discussion rather than just three questions and have the panel answer these three questions. Is that all right with you? Right. Very good. Well, shall we begin with Jeff Wong, who is from the Queen Mary University of London. Jeff, you have the floor.
Right, thank you. I'm told I'm banished now to the lectern. Right. Good morning. Thank you very much for inviting me. I have to make a number of apologies first. I'm not involved very much in the global health field. I predominantly work actually as an evidence synthesis person, but also in evaluation. I also work about a mile up the road as well as a general practitioner in this wonderful borough of Camden. Right. I am also making one other apology, which is I know we've had this problem before, which is I'm going to introduce a little bit more jargon and terminology, which of course I'll be happy to explain later on in the Q&A session or the sort of discussion session. And hopefully it won't be too confusing, and I will try and make sure that whatever I do present is as helpful as possible to all of you there. Right, so just as an overview, you can kind of sometimes see when people have been told how to make these presentations. So what are these particular methods? We're talking here today about realist methods. Why do we need yet another method? It sounds as if methods are a bit, to put it politely, like noses. Everybody has one. And then this issue regarding the sort of two words that seem to have come up quite a lot and often comes up in sort of many discussions about the many things that certainly you deal with and certainly myself on a clinical basis have to deal with, which is, well, it all depends on the context. And it's all really complex. And it's all sometimes a bit of an excuse to say, well, far too difficult to do anything about or to do anything you like. And then finally, just to say how these methods do differ from other methods. If they do at all, well, they will always certainly do in some respects and not in others. Right. So there are two types of realist methods. They're pretty much driven by the same logic of analysis, which I will cover in a minute. So there's realistic evaluation, now pretty much called realist evaluation. And this is theory-driven evaluation. It's primary research, so you go out there and you dig up your own data, or generate your own data. And then there's realist synthesis, which is sort of derived from realist evaluation, where you would look towards sort of documents predominantly. So this is a form of literature review, systematic review, secondary research. The goal is much more explanation and understanding. So it's pretty much more about, well, how does something work? Why does it work? Then rather than sort of judging it and saying, well, it does work, and to what extent, here's the effect size, let's say, in a systematic review. And so its usefulness perhaps may come certainly from your sort of area of practice in tailoring, in designing of interventions. Yep. So if you've got an intervention and you wish to understand or roll it out, scale it up, bung it in a different country, you might start to want to think about, well, what do I need to do to get the perhaps wonderful effect that I got in country A, but will it be the same as in country B? Right. So why do we need another method? Yeah, we all need another method like we need another nose. Maybe we do need another nose. Right, so you'll recognize some of these sort of little phrases. They come from the United Kingdom's Medical Research Council's a number of very heavily cited papers on complex interventions. So they're not simple black boxes, states the obvious, really. I think most of us know that. They have these multiple interacting components, whatever that means, so there's lots of bits to them. Most interventions, large programs, tend to have lots of parts to them. They deliver lots and lots of different things, and I'll just give you a very brief example later on. These components tend not to act in a linear fashion, and the way I interpret that is you can put a vast amount of effort in at one end and not necessarily get back your return, not either on the sort of final desired outcome or the sort of proximal outcomes, the outcomes along the way. So an example might be recruiting. You could spend vast amount of money recruiting or trying to get people to join a program, but you get a terrible little trickle, and this trickle is terribly frustrating because you're wondering, why aren't these people coming along? It's for whatever reason. And then lots of targets. People seem to be hit at different levels. My take on this is that the other terrible thing about these complex interventions is we wish we were all robots, really. We rely on people to carry out these interventions, both to respond to any of the initiatives and things being given to them, as well as the people who have to put the intervention or program itself on the ground, what they're actually having to do. Will they do what you ask them to do in the wonderful documents which you've sent them? There's a number and variability of outcomes, and it's highly dependent on the place in which they take place. Virtually everybody will say that, well, it always depends. Yes. And then this last thing here, which is quite sort of beloved of realists in some respects, is this idea of emergence. Things change as we go along, and I will give an example of that again in a second. So this is my highly simplified diagram of a complex intervention. It's, some of you may not have seen this. I think it's highly simplified. My sort of PowerPoint skills are particularly unable to make this three-dimensional. I would say that not only is there this layer that you can see, but there are layers above and layers below. And the point here I would make is that we have the desired outcomes. It might be E, and just to give you an example from my everyday work, it would be something wonderful like trying to get someone to stop smoking, big global problem, not necessarily something that we're talking about here today. And you might get E, which is, completely stop smoking. You might get L, someone who duals. They might smoke, natural cigarettes, and then they might also smoke these new electronic cigarettes. Or you might get someone who's M, like a sort of relapsing, remitting smoker who occasionally drops out of the program and then comes back again and comes to see myself and say, oh, doctor, I only lasted 6 weeks. Can I have some more patches? So you can kind of imagine along the way that someone might start off at A as being a recalcitrant smoker, comes along to see myself as a general practitioner, and then by B, they've got to the point of actually asking, right? And you think, oh, gosh, that's quite interesting. Now, within a program that stops smoking, to get people to stop smoking, they will offer many, many different things. They might, for example, offer nicotine replacement therapy. They might, for example, offer other wonderful things like a clinic. They might offer a reminder service. They might offer a sort of, sometimes called a nagging service, I guess. And then people will sort of to trundle along this particular pathway, hopefully ending at E, stopped smoking forever. But they won't necessarily. Some of the times it's harder to get people to do certain things, and then some of the times it's harder that people will fall back. And I would say, just to give an example of this emergence issue, is the way I might respond, or you might respond to someone who has initially come along endless, many, many years of saying, I have no intention of stopping smoking, doctor. Then compared to, they suddenly come in and say, oh, well, yes, I've actually decided that I might stop smoking. My response is going to be very different from sort of, oh, not him or her again, versus, oh, wow, really? Well, what would you like to know? What would you like me to help you with? Yep. So the response, the sort of attitude of myself to this particular individual might change, whether I like it or not. Okay, so how does it differ? And sorry, this is getting to the technical bits, and this is where the jargon comes in. I'm terribly sorry about that. So on the sort of philosophy of science, and how the world is constituted on an ontological level, Realist research is based and developed from and probably operationalized most clearly, not necessarily the only person who's applied this particular method, most clearly by Ray Pawson. So it's developed from this sort of philosophy of science, critical realism, to rather than creating another term, realism which can be applied by Ray Pawson. So it's about identifying and understanding and explaining causation through generative mechanisms. The underlying idea here, sorry, new jargon here. So a mechanism, I'll cover that in a second. The idea is that interventions themselves do not necessarily cause any outcomes. Yeah? So you can do something, but it won't necessarily cause an outcome, right? So what causes the outcome is this thing, the mechanism. And a mechanism is a sort of causal process, is a driving force. And if we say, probably best if I give you an example now. So if I have a pen here and I drop it, right, the mechanism is not me dropping it. The cause of it falling is not me dropping it. That is the intervention. I am deliberately releasing this pen. The thing that's causing it to hit the ground is gravity. Right? And this hopefully will then start to give us a bit of an idea about mechanisms. So one characteristic of mechanisms that most realists agree on is that they're hidden. You can't see them. None of us have ever seen gravity, but we are able to see the effects of gravity, the outcome. Yeah? So you can see a pattern. I let it go, it drops to the ground. The other thing that we can say about mechanisms is that they're real. It doesn't matter that we cannot see it. Yeah? Does it matter? It doesn't stop us, for example, trying to send missions to Mars, rockets to Pluto, probes to Pluto. We have to use this concept that doesn't actually, as far as we can tell, be touchable and seen, yeah? Real even. But it's a very, very useful process, causal process. And importantly, it's context dependent. Yeah? If I had done this exact thing, dropped this pen, on the moon, if we were on the moon, if we were lucky enough to be on the moon, then it may not have dropped at the same sort of speed. So it's context dependent. So what I would say that realism brings along because of its ontology is this ability to start tying together how an outcome occurs, have an area of interest. Let's start, here's a desirable little thing we want to start understanding because it's causal mechanisms. And then being able to tie in this thing of, well, it's all dependent on the context. And then you have to ask the question, well, how is it dependent on the context? What is the relationship between the outcome and the context? And here we have a logic of analysis that says it's because of this thing, the mechanism. And it's not particularly clever thinking either. It's not as if this is something completely new. We talk about mechanisms all the time when we talk about pharmaceuticals, mechanisms of actions of particular molecules on receptors. Right. Okay. Then we come around this last thing, little bit there, just above the B, where we're starting to talk about middle-range theories, or rather theories which are able to explain the relationship between the outcome, the context, and the mechanism. So that becomes then the next area of desirability. You may have some sort of configuration of what a context is, and a mechanism and an outcome is, but then how would one explain this? And this is where the sort of theories come in. And they're middle range, sorry, more technical jargon here. I'm not a sociologist, but they're middle range because they're close enough to the data to be testable. So these are sort of propositions you can then start putting together. That, this outcome occurs, pens fall to the ground because of gravity. And the value of gravity is of a particular value here, but its gravity value were to change because of mass, then it would fall slower, that sort of thing. Right. Epistemology, so how do we know something is knowledge? So we're starting here to talk about theories. Yeah, and it's slightly harder to prove a theory. I'm not saying this is, again, you'll have to excuse me here. The one excuse one has of being a general practitioner is that you know a great deal about a lot, but not a great deal about a lot, but not in depth about anything in particular. So this is, epistemology 101 as done by somebody who's a biomedically trained doctor. So knowledge should be judged by assessing the processes and assumptions by which it is produced. So I would say this is much more like detective work, right? Detective work, so you have to much more like detective work, so pretty much working as somebody, as we've already heard here, from the outcomes backwards. So what has caused this sort of outcome? And as with detective work, sometimes it's very, very difficult to be experimental. You know, I think if you were watching one of those TV programs like CSI, you might be able to, I don't know, shoot a bullet against some rock or some sort of target and work out whether or not, I don't know, the striae within the actual bullet look the same as the one that you found on the stuff, but it's pretty unexperimental. We have these sort of potential explanations, and the idea about the explanations are that they are right because often they're coherent, they're very plausible, and sometimes another criteria one might use is that they're kind of repeatedly successful. They seem to be pretty useful. You know, the theory of gravity is pretty coherent, pretty plausible, and pretty repeatedly successful, and therefore we might then be able to say that the theory of gravity is actually about as concrete as you can possibly ever get anything. Right.
You have 2 minutes.
I have 2 minutes and I shall finish. There are only 2 slides left. Just to be you know, get as it were, you know, one's cards on the table. So ontologically, one of the things that realists believe is that the world is stratified. So we have these sort of layers where particular causal processes, so the mechanisms themselves may not exist, either at the layer that we can observe, the layer below. It could be, you know, at the layer of the sort of society level, or it might be layer at the sort of at the layer of the, sort of the individual level. So the sort of world is sort of stratified, a bit like a sort of layer cake, and that causation doesn't happen because of an intervention. It happens because of it's generative, because of mechanisms themselves. I think epistemologically, we all face the problems of the underdetermination of theory. You know, we can have potentially competing theories which we need to be able to say, well, this is a much more likely one than another. I think that's pretty true of all science, really. The other thing one would say is that control is not necessarily something that you want to do, because if things are context dependent and you're stripping out the context, you may in fact be stripping out the thing which is an important trigger to the mechanism. And finally, this is probably again another message I've heard quite a lot today, throughout the sort of today and yesterday and today. It is pretty much that your methods should be driven by a very, very clear understanding of how you believe the world to be constituted, and also how it is that knowledge can be generated. So, you know, it's not a question of the tail wagging the dog. It should start from the sort of bottom up, as it were. And that's me. I finished, I hope, within time. I believe these slides will be made available for everybody, which is great. So if you want to read about realist evaluation, that's 1997. So it is probably as old as the hills, a bit like Ray Paulson himself. And then later on, that's realist. The sort of second book there is actually a realist synthesis, and that's his latest book, which explains the sort of understanding behind all of these things. If you're like myself, you know nothing about philosophy when you started off on this journey, as I did a few years back, you can always read books about philosophy. And the realist synthesis has quality reporting standards and training materials, and that may be found on those websites. So we have a discussion group as well for people who are interested in realist research. I have finished, and I thank you very much for your time, and I look forward to your questions.
Well, thanks very much, Jeff. We'll hold all the applause all to the end. Emanuela.
Good morning.
Morning.
I have a very different interpretation of the session topic than the previous speaker. So we're going to shift gears entirely. I'm also not from a mile down the street. I'm from about 6,000 miles across the Atlantic from Seattle. Thank you very much for having me. And this morning I'm going to talk about 3 examples of what I consider are complex interventions or programs that we're evaluating, and some of the innovative designs and methods that we can use to assess them. So I'm going to briefly touch on the evaluation of the Mesoamerican Health Initiative and the Gavi full country evaluation, then spend a little bit more time on a project that's the Malaria Control Policy Assessment Project that is being undertaken in Zambia and Uganda. So quickly on Mesoamerica, Salud Mesoamerica 2015, it's a initiative that's funded by the Gates Foundation, Fundación Carlos Slim in Mexico, and the Spanish government. It's managed by the IDB, the Inter-American Development Bank. It's a public-private partnership whose purpose is to improve health indicators for the poorest population, so the 20% poorest populations living in Mesoamerica, and they're using results-based financing as a way to implement interventions. It's a 5-year project, and we're the lead on the impact evaluation and the process evaluation for this initiative. The objectives of the evaluation is to achieve whether the countries are reaching their targets. So the good thing about this initiative is that they have set out targets at the onset. So our goal is to see whether countries are reaching the targets as they have been negotiated between the IDB, who holds the money, and each country separately. So the targets are not necessarily the same for all countries, but they're very similar. And then as a second goal is to evaluate the impact of specific components of all the interventions being undertaken in each country. If the term Mesoamerica is new to some of you, it refers to basically the south of Mexico from Chiapas all the way through to Panama, and it includes all the countries in that region. So the design we are applying to evaluate this very large and complex initiative is doing a baseline measurement right before the intervention gets started with 3 follow-up measurements over the course of the 5-year project. In most settings, but not all, we're able to have intervention and control groups. This is a fairly complex thing to evaluate. So some of the what we think are innovative ways to do the measurement include oversampling high-risk populations, so we can actually have enough of a sample size to make inferences at the end. We're capturing data electronically and using it to evaluate both quality of the data as it's being entered. All the partners have access to the data through a secure server, but also to see how project implementation is going. Another innovative part is that we're actually linking the health facilities where households are receiving care with the information we're getting from household surveys, so we can actually have the link between the supply side and the demand side for these communities. We do a lot of health facility observations and medical record review information extraction from charts, so we don't just rely on qualitative assessments in the facilities. And we're also using dried blood spot analysis, or DBS, to measure immunity status in the children rather than just relying on cards or immunization status as reported by the facilities. So these are some of the mechanisms we're using to evaluate a rather complex, multi-country, multi-year project. The second evaluation I want to mention briefly, because I didn't see it at all in the 2-day outline for this meeting, but it's a fairly large project, is the full country evaluation of Gavi. So the goal of the Gavi evaluation is to understand and quantify the barriers to and the drivers of immunization program improvement, including the contribution of Gavi in 5 countries. And you can see in this little schematic, the full country evaluation is part of the whole monitoring and evaluation process that Gavi has set in place for its activities, and it feeds directly into the ongoing monitoring and some more targeted studies that are being undertaken. This project is a 4-year prospective evaluation, and it is a delight to do a prospective evaluation. It has a budget of $16 million over the 4 years, and the 5 countries that we're undertaking this evaluation are Bangladesh, India, Mozambique, Uganda, and Zambia. So these are some of the questions we're trying to address in this evaluation. The idea being that Gavi is not the only agency that's doing something about immunization in these countries, nor are they the only funding source, but we're trying to look at the whole immunization system and the role of Gavi in it, and answer some more specific questions about Gavi's contribution to immunization rates and also ultimately reductions in child mortality. We're using a mixed methods approach, and what this really means is that we're doing 10 different studies to try and answer this question. It includes a process evaluation. We're doing a financial resource tracking exercise. We're doing facility surveys, household surveys. We have a verbal autopsy component. We're looking at vaccine effectiveness. We're doing small area analysis, and ultimately, of course, we're also looking at the impact of Gavi on immunizations and child mortality. we're using a lot of existing data, and we're supplementing it with what we call smart primary data collection. So we're trying to piggyback on existing programs like the DHS and oversample some populations or add additional questionnaires to a subsample of the people being included in a DHS already. And that's primarily to save costs and also take advantage of other large ongoing activities. So with that said, I'll switch to the project I really wanted to talk about. It's the Malaria Control Policy Assessment Project. Part of why I'm presenting it here is because we've heard a lot about PMI and the potential impact that malaria control interventions have had on child mortality in sub-Saharan Africa. So the motivation behind this study was that if we just look at what has happened in child mortality and scale up of ITNs, it's a story that is well documented. Child mortality is going down. Bad nets have been distributed at very high rates, especially over the past 10 years. And the Gates Foundation about 4 years ago came to us with a question of how much of the reduction in child mortality, so the dashed green line, the dark green line that's going down, can we actually attribute to malaria control interventions being scaled up in Zambia? Zambia, because it has been widely hailed as one of the success stories. So we took a step back and said, okay, well, let's see what has happened in Zambia during this time frame. This graph now is showing the scale up of malaria control interventions. But of course, malaria control is not the only thing that has happened in Zambia in the past couple of decades. There has been a large expansion of PMTCT and PEPFAR being a major player in Zambia since about 2003. In addition to that, immunization programs and activities have been completely transformed and scaled up. So since about the late 1990s, there's been introduction of child health weeks. New vaccines have been implemented. And this is only a short list of the health interventions that have happened since the mid-1990s, and it's not even looking at the more macro factors like economic growth that has happened in Zambia. It's not taking into account the huge improvements in the education of women of reproductive age, about a 40% increase during this time frame in the education of mothers in Zambia, all of which are contributing factors to this background trend in childhood mortality. Now, what we're trying to figure out here is, did the rate of child mortality actually accelerate as a result of malaria control interventions? And if so, by how much? And how can we tell? So the way we did this was to look at the district level. There are 72 districts in Zambia, so we measured everything we wanted, all the quantities of interest at the district level, and we have trends over time between 1990 and 2010. The map shows the evolution in under 5 mortality across districts from 90 to 2010, with red representing about 300 per 1,000 live births, deaths under the age of 5, and the dark green being closer to 80 per 1,000 live births, so still a pretty high under 5 mortality rate. I'll just show one more example. This is the scale up of IDNs and IRS. There are almost no malaria control interventions in 2000 in Zambia, and by 2010 you can see that the country has turned green. The scale up has happened across the country, which is very impressive, with some districts showing higher rates of uptake than others. And the graphs, we have done this for all the child health interventions that we could find data on, and the graphs look similar over time. So in trying to do the causal attribution, we wanted to really look at everything that has changed. So some of the variables that we were able to include, other than the malaria control interventions, are malnutrition, so the percent of children who are underweight, immunization, so we've looked at measles, DPT-3, pentavalent. We looked at antenatal care and skilled birth attendants. We looked at exclusive breastfeeding, which also has been scaled up dramatically in the past 10 years and has a huge impact on child mortality. We looked at PMTCT and, of course, at the macro socioeconomic factors that influence child mortality. Now, this is a list of what we were not able to look at but would have liked to look at had data been available, and it includes some malaria control interventions for which data are not available, like ACT coverage and IPTP coverage, and then some non-malaria interventions that are critically linked to child mortality. So in trying to decompose the changes in child mortality into the contributing factors, these are all the things we would have liked to take into account. The part on the left in green are the things that we are actually taking into account. We're a fairly quantitative institute where I work, so you can imagine we tested pretty much any model that anybody in this room could name. We have tested it, and it ranges from linear models all the way to structural equation modeling and other models. We have tried any number of combinations of interventions, and using random effects, fixed effects, everything you can imagine, we've also tried it. In the end, I'm going to show you results from a linear model with bootstrapping, which we're currently favoring as our best model. I thought somebody had to put an equation up at a conference on evaluation. So here's the model. And when you look at everything and you have under 5 mortality on the left-hand side, and you put all these interventions on the right-hand side, nothing comes out significant. I'm sorry, the table is not showing up very clearly. But you can imagine with so many things going on, it's really difficult to figure out what actually is leading to the reduction in under 5 mortality. So we took a step back and we said, okay, let's see what actually happened. So this is the trend between 1990 and 2010 in ITN ownership. But of course, this was not the only thing that scaled up dramatically in Zambia. Right? So there are at least 3 other interventions that we have measured that scaled up during the same time from levels very close to 0%, reaching very high coverage levels in 2010. And the ones I'm showing here are pentavalent vaccine, the number of facilities that are offering PMTCT because we didn't have population rates of PMTCT, and exclusive breastfeeding. All of those are linked to child mortality. So in some way, it's not fair for somebody to ask me what has been the contribution of the malaria control scale up to child mortality. And in some ways, it's my responsibility as a quantitative analyst to say, well, given this graph, I really can't tell you. So what we ended up doing is we combined all the interventions that have had this rapid scale up into one factor of all the things that Zambia has done very well in the past 10 years in promoting throughout the country and having massive scale up. And we ran the model again. So the counterfactual scenario that we're looking at here is what would have happened to child mortality in Zambia had all these interventions that were rapidly scaled up not been scaled up. So we can't look specifically at ITNs or IRS or breastfeeding. We're looking at all of them at the same time. So status quo is 110 deaths per 1,000 live births for the country. If the rates of coverage had stayed at the 2005 levels for these variables, we would have seen 119 deaths per 1,000 live births, so 8% higher. And if they had stayed at the 2000 levels, so the levels were close to 0. So if rapid scale up of ITMs, breastfeeding, pentavalent, and PMTCT had not happened, we would expect that child mortality in 2010 would have been 13% higher than what we actually saw, which is actually a remarkable reduction and acceleration in the pace of child mortality reduction. So thinking back on implications of our studies for broad, complex global health evaluations, retrospective evaluations are always limited by available data. You can't go in and design your own study to answer the question. And what this means is that sometimes you can't actually answer the question you set out to answer, but you still learn a lot of valuable information along the way. So, of course, as an evaluator, my pitch is that large global health programs and initiatives need to actually build in evaluation from the beginning, like the studies on Mesoamerica that I was referring to, because the evidence base on what works and what does not work urgently needs to be expanded in our field. Thank you very much.
Thank you very much, Emmanuel. Now we'll have Kane. Kane, you have the floor.
Thank you. My name is Kane Rolliston. I am from around the corner in the Institute of Education. Something of an imposter in a health conference, I feel, but I hope there's something we can learn from comparative systems analysis in education across the disciplines into health too. So what I'm going to talk about in this presentation is work that I did in Oxford University last year in a project called Young Lives, which is a international comparative study of childhood poverty with an education focus. The education research in the last 20 years in developing countries has often been criticized for having certain features, undesirable features of being fragmented, small scale, non-cumulative, methodologically flawed, and also for being politically motivated or researcher-driven and of limited relevance for policy and practice. Now, of course, clearly this is not applicable to all education research, and there's been a huge amount of really good quality stuff too, but that is something we hear quite a lot, especially from donors. And this has led to, in many ways, an increasing emphasis on what's considered to be a gold standard of experimental methods, which are, of course, in part derived from health, particularly randomized control trials. And those are taking place more and more in education with some very interesting results, but of course being quite limited in terms of their scale. And they don't tell us an awful lot about the performance of education systems. And so the issue of a gold standard, as it were, in observational research is what we've been looking at, and how we can better improve understanding of the differences between education systems, because those are the largest differences between countries in terms of learning levels. It's not between rich and poor, between boys and girls, but between one country and another. And we need to look at that through non-experimental observational methods, and preferably using mixed methods. So the Young Lives Survey was originally designed as a longitudinal study of childhood poverty, and it contains 12,000 children born in 2 cohorts. The study started in 2002 in 4 countries: Ethiopia, Peru, Vietnam and India. And in each of those 4 countries there are 20 sentinel sites, surveillance sites, which contain 200 households and children of the selected ages. There's also a qualitative component on a smaller scale for each of the countries. Now, in 2010, when the younger cohort of children reached the age of 10, we started to include them in school surveys. The school surveys focused on children's learning in maths and literacy and on their progress in learning over time. We also looked at school and teacher effectiveness in a longitudinal within-school design, so that we were testing children at the beginning and at the end of the school year, testing their teachers too in the core curriculum subjects. And we included not only those indexed children that are in the household survey, but some of their class peers, to get a balanced sample of children at the school and class level. So we have in this particular survey school information, but we also unusually have information going back to the child's birth as far as 2001. So we've got a rich set of household background controls as well as school information, which is relatively unusual in developing countries. And so the question of the extent to which schools matter is a particularly tricky one, because education systems vary in so many dimensions that it's quite difficult to compare. And the issues of school inputs, there are a huge number of studies. Paul Glevy, for example, reviews 79 studies in the last 10 years of the effectiveness of schools in the education production function model, and finds that there are very, very few consistent effects in regression analysis of individual school inputs. And in fact, not only that, but those effects which are consistently significant are pretty much the most obvious ones, are not particularly surprising, and don't offer a huge amount of guidance for additional programs and projects. So that's partly because of the large differences in context, but also because of the very large number of variables that are included in school effectiveness studies. So nonetheless, despite the poor consistency of findings in research in education production, there are large differences in pupil achievement, and there are large differences in the effectiveness of education systems, but it seems that those are bound up with different kinds of system characteristics, political economy characteristics, and bundles of inputs which vary in inconsistent ways across countries. We look at the 4 countries here which were in the Young Lives study, which is Vietnam, Ethiopia, Peru and India. You can see that there are, when we administer the same kinds of tests, very large differences in children's performance, not just at different ages, but also in terms of the change over time. So at age 7 or 8, which is the first time we administered these tests, there's a smaller difference between the 3 countries, except Ethiopia, which has the lowest levels of basic numeracy. But then over time, children in India don't make anywhere near as much progress in maths learning as children in Vietnam. There is a big difference in terms of change over time, and it's partly due to the fact that although the curricula are the same in all 4 countries, the level of ambitiousness of the curricula related to children's actual learning levels is much greater in India. The expectations of the curriculum are very high, but the performance of the children by age 14, for example, is really very low. Performance has fallen way behind what the curriculum and the textbooks are expecting. So in Vietnam, however, the curriculum remains in line with the pupil's actual performance. And the effect of this, as you can see in this graph here, is that at age 7 and 8, there's very little difference between children's performance in two countries. Here it's India and Vietnam. Each of the bars represents the average for one of the sentinel sites in the 20 sites in each of the countries. Very little difference at age 7 or 8, but by age 14 and 15, the difference between Vietnam and India is enormous, despite the fact that children are enrolled for the same number of years of school. So if we look at that then across all of the 4 countries using comparable tests, which actually ask the same questions translated into the 4 different languages, we can see that the pupils in Vietnam make much greater progress over time. So on the bottom axis here, that's the average score for each of the decile of the original performance at age 7, then plotted against the same children's performance at 3 years later, which is in round 3 of the Young Lives survey. So we're comparing like with like here. Pupils who gained 40% in the test at age 7 in Ethiopia are then performing much worse than the equivalent pupils in Vietnam 3 years later. And we want to understand what accounts for that. What are the differences between education systems? And it's very complex. So there are differences in characteristics. If here we're comparing Vietnam and India, we can see that in fact class size favours India. There's a much smaller class size in India than Vietnam. In state schools, very low class sizes in our sample. The number of teacher years of experience is much higher in Vietnam, although the teacher's salary is much higher in India. Inconsistent patterns of explanatory variables here, which is partly related to the fact that it's difficult to find significant differences in regression. There are greater proportion of unqualified teachers in India and a much higher proportion of teacher absenteeism. That question was asked in different ways in the 2 countries, but in India we found that 35% of pupils said their class teacher did often not come to school, whereas in Vietnam it was extremely rare and the average teacher took only 2 days of non-attendance at school. So big differences there. Access to textbooks was also much more favourable in Vietnam, and teachers' checking and marking of homework was also much more positive. So again, some indicators. But assessing school quality in comparative terms between 2 systems is quite complex, because what you really need is to be able to measure the value added over time. And to do that, you need to be able to separate the effects of pupils' backgrounds from their prior attainment, which requires a longitudinal design, repeated measures of test scores at the school level. And that also requires, of course, linked data between teachers, schools, and pupil backgrounds. It's a quite sophisticated design that gathers all of that data, which we have been able to do to some extent in these 4 countries. But then ultimately, you need to be able to link the test scores at different stages of the child's life on a common interval scale, so that you can really assess the impacts of change over time. And when we have done that, what we see is that there are big differences in cross-sectional effects compared to longitudinal effects. And so here, this regression table compares scores in Vietnamese language with the effects of male gender and ethnic minority status in 2011 as a cross-section, in 2012 as a cross-section, and then in the 3rd column, looking at the value added by including the 2011 score as an explanatory variable. And then we see that although that girls do better in both 2011 and in 2012, there's a significant effect of being a girl, positive effect, and in terms of value added, girls also make more progress in the Vietnamese education system. But ethnic minorities, whilst they did worse in 2011, we see that difference disappears by 2012, and that the value added difference is almost 0, which indicates to us then that the difference between ethnic minorities and Vietnamese kin ethnic majority pupils originated much earlier on in school and was then fading out as time progressed, likely because, of course, they don't speak Vietnamese at home, and so that Vietnamese learning in school was accelerating the difference, or sorry, reducing the difference.
You said girls, but the table says boys, huh?
Sorry, so because it's a negative effect, I was talking about girls there. So the negative effect for boys means that girls were doing better.
Okay, sorry.
So that one challenge is measuring school quality and measuring it in a comparable way across systems. Another challenge in developing countries, particularly for us in education, is developing context-appropriate learning measures, because these are extremely difficult to compare. progressive linked pupil achievement tests over time, which also take account of non-cognitive skills, for example, school engagement, self-confidence, those other aspects of learning which are very important, are all a part of the package of assessments that we have administered, in addition to teacher tests, and then scaling those tests using latent trait models to be able to look at change over time in a comparable way. So value-added analysis, that, as I just described, requires an understanding of both school and teacher quality, but methodological rigor in constructing these assessments is not only a technical issue, it's very much about the relevance of the tests, and those tests must be relevant to the curriculum, but also to the cultural context. And the design of these relevant learning metrics and non-cognitive measures in developing countries has been extremely demanding, since, unlike OECD countries where PISA and TIMSS and other comparative assessments are well established, it's not the case that such tests exist in our countries. So, just to give an example, the most challenging country in developing these kinds of assessments was Ethiopia, because we have there not only low literacy levels but highly variable literacy levels, so tests have to cover a wide range of abilities but also balance national curricula and expectations with international norms so that we can have some kind of valid comparison in both literacy and numeracy. Also in Ethiopia we had 8 linguistic groups and languages of instruction in the school, so there was a challenge not only to compare across countries but within regions of Ethiopia, since questions had to be constructed in different languages, and then there were issues of linking those test items for equivalence, since there were different cultural contexts, differences between textbooks, differences between modes of instruction. So we've used item response theory, latent trait models, to construct these measures over time and to look at differences between languages, and also to include common items at the beginning and end of the school year to measure progress. Back to Vietnam, once we've been able to do that and to examine the value added of schools, we here plot on this graph the average value added of each of the schools that were included in the survey. There were 92 schools here. I've got about 60 for which this study was effective. And we've ranked the schools there in terms of their value added, with 0 being the average school, and then the bars representing the confidence interval for the added value of the school. So all those which are above 0 were better than average schools in terms of school quality, and those below were worse. And we then looked at that in terms of the correlation between the value added measure and the characteristics of the school, which of course is not causation. And as was said earlier, this is rather more detective work than it is cause or attribution. But what we did find was that schools which add more value were not those in Vietnam that had more advantaged pupils. They were those with slightly better resources. They were those, however, with not necessarily better teacher subject knowledge, but with more permanent teachers, more teachers with degrees, and teachers with more positive attitudes. We had a teacher questionnaire which assessed teachers' attitudes towards pupils' abilities to learn. And there was quite strong correlation between questions like, to what extent do you think the influence of a student's home experience can be overcome by good teaching? Those kinds of questions, teachers who responded positively to those were correlated with children who made more progress. So, moving towards the end of the value-added section of this discussion, we asked the question of, let's compare between Peru and Vietnam. Is there a difference in the extent to which schools are more or less effective for pupils from different kinds of backgrounds? And so are schools discriminating in terms of who they make the most progress for? And when we compared then what's the effect of increasing school quality in terms of the value-added measure that we constructed on the least versus the most advantaged pupils, we found that in Vietnam, increasing school quality, in fact, was neutral. There was no greater benefit to more advantaged pupils from being in a better school. Everybody benefited equally, or at least the difference is not statistically significant. Whereas in Peru, which has a much more unequal system, we found that increasing school quality benefited pupils from more advantaged households much more than it benefited those children from less advantaged households. Again, that's some kind of puzzle which needs further explanation, but it seems to me that it's likely that in Peru, which is a very unequal system, there is a degree of elitism in which the school system teaches towards the more advantaged pupils, and so better schools do that even more so. And so the disadvantaged, for the least advantaged children, is yet worse in schools of higher quality.
Again, you have 1 minute.
So to conclude, really, the question that we were asked by the donor, which is DFID, really is how can we understand what the differences are about the Vietnamese system? Why does that appear to be more effective over time? And the general lessons are that it's an equity-oriented, centralised public school system. There's less evidence that disadvantaged pupils attend poor-quality schools in Vietnam. There's greater equity and less evidence that schools are less effective for disadvantaged pupils. And higher performance for the majority of pupils is linked to that equity orientation. What does Vietnam do to achieve that? It has an emphasis on fundamental or minimum school quality. So minimum school quality means that the least advantaged pupils and the most disadvantaged areas do not suffer from as extreme disadvantage as they do in the other countries in our study. There's also a greater degree of common standardization in terms of curricula and textbooks, which are more closely matched to pupils' learning levels and abilities. And there's a commitment to mastery by all pupils and the use of regular assessment by teachers. And teacher knowledge in our own tests is in fact also more similar. There's less of a distribution in terms of teachers' abilities and a lower level of teacher absenteeism. So finally, the messages from this kind of comparative evaluation study is that in education there are still inadequate data on learning metrics in developing countries. There are very few rigorous assessments of students' learning performance. And in order to really assess school quality, you need a robust longitudinal design. The largest differences we know are between systems. More than between, for example, public and private schools, the differences between countries are enormous. And some systems are more heterogeneous in terms of their performance than others. Peru, by comparison with Vietnam. Those countries that focus on a centralized minimum standard do seem to have considerable benefits because in terms of average levels of learning, bringing up the bottom, the long tail of low-performing students, is the most obvious way to improve the average. However, context is paramount, and in order to understand what is a theory of change, how do you take this data in order to improve education systems, there's no one way of doing that since systems vary enormously. If we look at Vietnam, that's a centralized, authoritarian, technocratic system of education, whereas if we look at India, it's very much more federal, democratic, bureaucratic, pluralistic, and so the theory of change that's required for those two kinds of education systems is quite different. Thank you.
Thank you very much. Before we go on, any questions from our audience web? Are there any? None.
Sorry, are you inviting questions?
Sorry?
Are you inviting?
At first I was asking about the web. Are there any from the web? Then I'm inviting questions. There are none. Any questions?
Yep.
Elliot, we gave you pride of place.
Picking on the last one because it raised many questions for me. You began by acknowledging that school effects and the general evidence from school effects is limited from literature comparative work that you cited. You then made a distinction which I found rather unclear between school systems, which I guess you meant education systems, and wider society, political economy, context, however one groups that together. So having said that school effects generally seem to be limited, you then went on to study schools, and your interpretations of the evidence erred towards concluding that the school effects were significant in making the difference. So, for example, in relation to the boys and girls differences, or particularly the ethnic minority, where you cited that they learnt language, whereas at the beginning they may not have had grasp of the language, you seem to be assuming that that was because of school effects, as opposed to policies in Vietnam that might be regarding a greater integration of minorities into society overall and other remedial policies that might be ongoing. And similarly, Peru, as you actually did acknowledge, is a much more unequal society with fewer strategies to involve the marginalized. So on the one hand, you seem to be giving a picture which suggests that school is not where we should be looking for our primary explanations. On the other hand, you're focusing your explanations as if schools are indeed the major source of variance. And the fuzzy ground in the middle for me was the distinction between school effects and education systems, and what goes into that as opposed to what goes into context, however one describes it. This may be my question may be confused, but I'm picking up directly on the things that troubled me in your presentation, even though I find very interesting.
Thanks very much. Thank you, Dave. Next, and then one of my colleagues, please, yes. Let's thank you first and then yourself.
Okay, I'm sure.
I'd ask you, one of the things that he said is that if you can give suggestions of looking forward, in other words, how we look forward, what are some of the things we might take forward? Sorry, go ahead.
Shungita Mukherjee from George Washington University. So I think I'm maybe going to pick on Emanuela a little bit.
Is that microphone on?
I have no idea.
It is.
Yes, it is. I saw a lot of data collection techniques that you listed as methods, and this is something that I've sort of heard over and over in our conversations so far in this workshop, where I'm not clear if, to me, data collection techniques do not equal methods. It's just, you also have to think about the analytical part of it and how you're going to treat the data. So that was something that I was a little bit confused about, and I don't know if we're all clear about that. So I saw a lot of, some interesting data collection techniques, but I didn't quite understand how the methods and the designs were that different or innovative for the three examples that you presented. And I thought it was interesting that at the end you mentioned that these large-scale complex interventions should include plans for impact evaluation at the beginning, and we've been talking about that as well. But I had trouble understanding, for example, with Zambia, how would have including an impact evaluation plan have helped disentangle the synergistic or cumulative, or however, we don't really understand how all of those different child health interventions come together and contribute to child mortality reduction. And would a theory have helped with disentangling even if regression analysis didn't? I'm finding also there's a theme, and I'd love to hear from the panelists, there seems to be a theme that our biggest challenge is overcoming not just what we might think of as implementation heterogeneity, but actual intervention heterogeneity. Like we're talking about things trying to achieve maybe similar, quite proximate outcomes or impacts, but we're doing quite different things, even though we call it malaria control or we call it education improvement or school strengthening or something. And that to me seems like the main methodological challenge that we have nowadays with evaluation. So I'd love to hear about that.
Interesting. That relates very much to Elliot's question about intervention heterogeneity and the impact of intervention heterogeneity. My colleague, please, yes.
Yes, Marie Laga from Institute of Tropical Medicine in Antwerp, Belgium. I just wanted to, a question to the first speaker on realist evaluation. It's one of the methods that I've been trying to understand for a while and been reading often and always try to find applications in health for it to better. I think I understand it conceptually, but I can't yet understand fully whether this is just, I would say, is this an additional method to better understand the why and the how, or is this a completely different approach? And I'm just asking you, if you were to apply it on the example of Zambia that was presented by the second speaker, which was very much approached from a quantitative way, if you were asked the question from a realist point of view, help me to understand whether malaria control has been the main contributor to the decline in child mortality, what would be your approach from a realist point of view? Is that just then, do I understand well that then it's like more an added component of mixed methods and more the qualitative work, or is it a completely different approach? It's just, if you apply it to another example than dropping the pen, that would help to understand.
I must say you and I are in the same boat. Let us start with Kane for a specific response, then Manuela, and then Jeff.
So I think that was an important question, and perhaps I didn't make it quite clear that there's a distinction between. I didn't want to suggest that schools were not important in terms of determining learning outcomes, because they are. It's just that when you look at this in terms of disaggregating the impact of individual variables, let's say teacher qualification, anything which can be separated out as an element of the quality of schools, those kinds of regressions show very inconsistent results. So we know that schools matter. The difference between school performance is very large, whether you measure that in terms of cross-sectional or even if you do a value-added study, you'll see that children in different schools make very different levels of progress, but we only have that really as a kind of fixed effect. What we don't know is exactly how that can be separated out into the individual components of the school production. So I think that what I was suggesting is that in terms of the comparison between Vietnam and Peru, for example, what we're doing there was you're just comparing fixed effects of schools, individual fixed effects. So it's the difference made by the school but not separated out into the inputs that the school is comprised of. And so the question of ethnic minorities, performance in language, in Vietnamese language, for example, that was a value-added analysis where, in fact, it's at the beginning and the end of the school year, the children tested in Vietnamese. So most of the inputs are the same in terms of the fact that they have the same teacher, they have the same class peers. All of those things are held constant. It's perfectly possible, of course, that there are other influences outside of the school which are affecting their Vietnamese language acquisition, but we would then expect many of those to be the same, since they're in the same sentinel site communities and so on as the ethnic majority children, the kin pupils as well. So I think there's some reason to think that the narrowing of the gap in language learning over time is attributable to the school in that case, but we're not able to say in exactly what way.
Okay. Manuela.
So that was a lot of questions. I'm going to try to not take up too much time, but let me start with the question about whether data collection mechanisms are methods. And I guess my answer to that would be, if you do your data collection well and you have a well-designed study, you shouldn't need a statistician, right? We should not be doing statistical gymnastics to figure out the impact of a study. If you have a well-designed evaluation, you should just look what happened at baseline, what happened afterwards, control versus treatment, and figure out your effect. So part of why we're investing in these innovative data collection mechanisms are because we should not be using people with PhD in statistics to answer the question of what has been the impact of an intervention. I realize that may put me out of business in a few years, but that's where I'd like it to move. But some of the ways in which our data collection systems are innovative is by linking the supply side and the demand side, we can have a better understanding of the barriers to improvement in health outcomes. So if we have information from the household and the health facility and the district health office, and it's all linked, we can actually understand all the layers of the health system and where things may be going wrong. Then you ask the question, how would I do it in Zambia? There are many different ways to do it than what we did, and I would start by not looking at under 5 mortality, right? If I'm PMI or if I'm the Global Fund, I don't want to look at overall under 5 mortality because I work on malaria. So I would want to measure cases. I would want to measure deaths. I don't think it's acceptable that in 2014 we don't know the number of cases and deaths in Zambia with as much accuracy as we could. I mean, there are many people in the room that produce estimates, and we do as well. So first of all, I wouldn't look at under 5 mortality. If I come in years after the intervention has been implemented, theory could be useful. Better data would definitely be useful. More data would be good. Data on ACTs would be great. Data on RDTs would be great. There's a lot of things that we don't have data on because it's not routinely collected. And given the investment that has gone into malaria control in these countries, and I'm the seasoned Zambian as an example, but it's the same all over sub-Saharan Africa, it's really not acceptable that we don't have better information to answer the question.
I do agree with that, but so if an impact evaluation plan had been able to be put in place at the start of this, then you would suggests that they actually not use what we typically consider to be an impact indicator, like under 5 mortality, but use a more proximate outcome indicator, like cases averted or reduced or something like that.
And we're
I'm
going
just trying
into,
to clarify.
we're going into the lingo here of what is an outcome and what is an output, what is a process indicator. But if you're, my opinion would be if you're trying to look at the impact of an intervention on malaria, then you measure the cases of malaria and mortality from malaria, and I would consider those outcome indicators.
Okay, agreed. I mean, I was just trying to clarify.
Yeah.
Okay. Help us.
Oh, help you, right. I'm not sure I can do that. Just as a starting point, was I right in thinking you're from the Institute of Tropical Medicine in Antwerp? Yeah, I mean, one of your colleagues there, Bruno Markel, I mean, I certainly would go and approach him, especially since he works in sort of much more of an international area than myself. But anyway, I'm going to pick up on this issue of intervention heterogeneity because it is relevant to your question. I'm not trying to duck and dive and avoid the question. Because
you will get to the question.
Oh, of course I'll get to the question, yes, absolutely. I've been tasked to get to the question. Right, and this issue about intervention heterogeneity, I think if we think of realist approaches or methods more as a sort of logic of analysis, then what one starts to see within interventions is that there are actually families of interventions. So we do certain things because we believe they're going to cause certain outcomes. And the focus becomes an understanding of why we believe these certain outcomes would occur. So the language that Ray Paulson would use is that, interventions and programs are pretty much the theory incarnate. So we have within our heads ideas. And what the realist approach or approaches would be able to do would be to say, look, let's not focus on what people do. Right, because we do a number of things. We might, for example, provide nets or hand out free drugs, provide a clinic or whatever. But what are they what is the mechanism that they're trying to trigger? Yeah. So that becomes an area and a reason for focus. Now, you're then going to think, well, why bother to think about mechanisms? Well, for a number of reasons, really. So this is an assumption, and I'm not saying it's not necessarily true in all cases, but mechanisms are pretty universal. They're relatively durable. So I go to the example of dropping the pen again, but I will come to much more sort of perhaps social science type mechanisms. So gravity is a universal phenomena. It is therefore of interest to us. So we should be looking at things which help us understand that rather than perhaps specific kinds of interventions. Yeah. If we, let's say, want to understand about, let's say, the theories about diffusions of innovation, we have a number of theoretical explanations, substantive theory about how innovation gets disseminated and innovation gets taken up. And there are specific, well, I'm not saying the theories are cast in a realist light, as it were. You can reframe the theories in order to understand that, in fact, some of the things, like, for example, relative advantage, can be conceptualized as a mechanism. Yeah. So you can start looking at interventions which specifically start to provide, change the context in such a way that relative advantage will be triggered. So the intervention specifically triggers the context. Now,
yes.
Did you want to? You're welcome to ask me something.
I'm wanting to answer the question.
Okay, what the question regarding... The question regarding Zambia is actually quite tricky. It would be quite difficult to answer with the realist methods because we have to match methods to the question being asked. However, the question regarding the educational attainment of children between countries would be one which is quite amenable. Okay. So one would use case comparison again, and one would try perhaps to put together a program theory, an understanding of why it is that, for example, having a better structural building or some description, or teachers dropping up more. How and why would all of those, within a program theory, explain attainment? Yeah. Okay. So it's more about understanding. I think that the question regarding Zambia would be quite difficult to answer, and that's an honest answer to that.
Okay, good. Please. Sorry to push you, but your question is very specific.
No, perfectly happy to be pushed.
I have a question for Kane that maybe Jeff wants to come in on. One of the things that really perked my ears up when you were talking was the observation about differences in teacher attitudes. that I think it was in Vietnam, the teachers had a higher pre-existing belief, apparently, in their children's ability to learn and to advance than the teachers in India, if I understood you. And that was based on a survey question. Didn't make your concluding remarks, so I don't know whether statistically that observation fell. Really my first question. And then my second question would be to Jeff, whether whether that sort of observation triggers realist evaluation type questions. One thing we've been talking about throughout the meeting is the role on the sort of the micro context, meaning people, the people responsible for delivery of interventions. And that seems like a people-driven difference.
Thanks. Yes, please, here.
Great, thanks so much. It was nice to see some real research and some meaty stuff. So a couple of quick questions. One is for Emanuela. So if you did have the way of sort of thinking forward, if you did have a way of collecting the right information to answer that question, what would you collect? And then is that sort of information that you would suggest, or what would you suggest for as a way of routine information to be collected that would enable evaluations like that? And then the second question is sort of between Kane and Emanuela is sort of, I always thought that in health we're sort of lucky because it's easy for us to define outcomes. People are either alive or dead, and you either have a disease or not. It's much more difficult in education, but maybe it's a little bit of a simple-minded way of thinking about it, and what kind of lessons we can learn about outcome measurements or thinking about outcomes that can come from the education field, and from sort of your side, Emanuela, if there are sort of different ways of that we should think about what it is that we're sort of measuring at the very end.
The third one is from my colleague from the Institute in Washington. Yes, please. I'm sorry I forgot your name from this morning.
Yes, Tessica Tsambas from Encompass LLC from Washington, D.C.
Yes, I
So
do remember
my
that.
question is actually going a little bit at a higher level from this conversation, looking at the topic of the issues that are becoming more important in evaluation. And I'm a little bit surprised to see the absence of some things that at least are being discussed in different other fora, such as the UNDP-sponsored National Evaluation Capacities Conference, such as the International Organization for Cooperation and Evaluation, and certainly in the United States, where I'm more familiar with all the things that we talk about at our conferences. So I'm thinking about things such as the change that we're seeing in country-driven evaluation, country-driven programs, and the OECD DAC efforts to build evaluation capacity and the struggle really to figure out how to engage meaningfully with developing country, partner country evaluators, and how to create these teams that are much more local, have more local representation. So that's one issue. The second one that I hear that's really big is about facilitating the process of evaluation so that the models that you were all discussing today are realistic, are used, are connected to reality. So it's not, they don't stay at a philosophical level, but they really engage people and allow for evaluation participants to shape the agenda, even the agenda of the evaluation. So that's another issue. The other big, I think the other big methodological trend is around systems thinking and in evaluation. So that's coming out of Australia, that's coming out of the whole quality assurance, quality improvement movement, that's coming out of Michael Patton's developmental evaluation work. So I'm just a little bit surprised not to have heard more about these trends that to me are very, very prevalent.
Before the answer, your first question, I don't know if you were here yesterday, were you?
I was not here yesterday.
Yeah, but the first...
This morning.
No, yesterday, this issue of developing countries was addressed. And in the coffee break, Bridget was lamenting some of the very things you've said, that if we had more time, we would have addressed some of these other issues. But the time and the remit was restricted to mixed methods evaluations, a large complex system. But she would agree with you 100%. It would have been nice to address some of these other issues. Now, shall I go on to, who wants to start? Emmanuel, with the questions that were asked.
Sure, I can start the specific question on what to measure. And I mean, it depends on what you're evaluating. But I've done a fair number of projects in Zambia over the past few years. Some of them have to do with HIV, some of them are broad health systems, some of them are malaria. In a recent study, we extracted about 10,000 medical charts of HIV-positive patients. And the amount of information that is in the medical charts is shockingly low. So, you're talking about evaluating PEPFAR. Well, you go and look at the medical charts, most people don't have 2 CD4 counts. Most people have, if they have it, they have 1 WHO staging. Weight and height, which should happen at every visit, really doesn't happen, right? So, the systems are there. You don't really need to implement a system. You just need to create incentives and have better monitoring and better measurement. If nobody pays attention to what is being collected, nobody ever looks at the charts, and nobody feeds back to the people putting in the information, the system is not going to improve. So the indicators we need to measure are not that complicated. A lot of the existing systems could be utilized. It's just not happening. And then, I very much enjoyed hearing about the field of education. I had this fantasy that we would actually go into health facilities and test some of the knowledge of the health personnel and do assessments over a country. And actually, it has happened in 4 countries through some World Bank surveys, but it would be great to learn from all the methods that the education field has developed, both within country to benchmark using IRT and other techniques that they have, but also across countries. I think there's a lot to learn from the field of education. I was very excited to hear about your work.
Ken, do you have any comments?
To respond to that question, but also, I don't know an awful lot about realist evaluation, but from what I heard, it sounds like it has more direct application in this kind of comparative systems work, as you suggested. But I didn't conclude that teachers' attitudes were a causal impact on children's learning, because that's what's really tricky to do with any kind of retrospective statistical analysis. I mean, even if the effects are significant, which they're usually not, that doesn't identify a causal relationship. But what we had there was that I only suggested that the schools which had the largest effects on learning were those in which the teachers typically more often had those positive attitudes, and those, along with the other things I listed there, they were just correlations between effective schools and some characteristics. So I wouldn't want to conclude that they were causal. However, going back to realist evaluation, I think that's exactly what it's about. It's about saying, that statistics is not the only way to understand causal relationships. We actually do know why a good textbook is effective. Any teacher can explain to you why a particular textbook is better or worse than another. You don't need a statistical analysis for that. So we shouldn't rely on statistics to give us, as Emanuela said, things which are in many ways common sense. And so we need to have some in education. The education departments in those countries can give you lots of explanations as to why these things might matter, and you have to start from there, not from barren empiricism.
Yes, Jeff, any comments?
Yes, I think just to pick up on a couple of things, the teacher attitudes. It's a very good question. How one would incorporate that would be to look at, or first of all, to take it as an observation that potentially may be interesting. So here's a pattern within the data. So the pattern within the data would require some sort of explanation as to why the pattern occurs. Now, one can build a program theory around that. So how does teacher attitudes, if at all, have any impact? So what is its sort of pathway? I suspect it's not directly about teachers' attitudes and then students perform better. It's probably about teachers' attitudes and a whole bunch of other things. I'm not an educationist, don't pretend to be. So one could try and flesh out what that might involve. So that would be the sort of program theory. It would be a realist program theory, because one would want to understand, is the teacher attitude potentially a sort of contextual element within this program theory, or is it potentially even a sort of a moniker for us, a type of a sort of overall mechanism, that there's a substantive theory around that area there. So that's how one would incorporate observations. And I think one of the things that, thank heavens, we have often is often a lot of observations. So the idea would be where would these and how do these observations fit together? So it's the lines between these observations in the explanation of these observations. Now, how one would go about evidencing whether or not the program theory is correct or not correct. I think we've had some very interesting work yesterday, for example, regarding things like triangulation. You know, data comes from different directions. People may say, oh yes, this is how I think it works. And policy documents might go, yes, this is definitely how it works. But one would also then have observational data to say, well, actually, this is not how it works. And the sort of contestation between this would allow a sort of refinement. And often explanations come from case comparisons between where invariably there are sites where, it's the poster child. This is an immensely successful site. Therefore, they must have done something right or a bunch of things right. And then there are those which have just, I wouldn't say necessarily failed spectacularly, but perhaps not met up with expectations in terms of performance. And they would therefore be of interest as well, because they will provide information on how to populate the information within a program theory. Just coming back to systems thinking, I'm not a systems thinking person, and I would say, in fact, that one of the sort of great things about realist reviews or approaches are that an evaluation is that actually pretty much anything is fair game, right? So one may well be able to look at a much more sort of structural level explanation, explanation and mechanisms there, or go all the way down, if necessary, all the way down to sort of molecular, and say, well, actually, we know enough about the mechanisms for, I don't know, the cause of how cigarette smoke causes cancer, so we can kind of ignore that, but we can go up to one level and then start thinking about, what are the societal pressures on people to smoke or not smoke. You can start talking about sort of elements of where power might fit into an equation. Is that a contextual element? Is it actually part of a mechanism for a particular proximal outcome or a final outcome? So it's a way of perhaps encompassing the idea that we should be thinking broader, at least.
Well, I think we've had quite a good discussion. I must say, at the end of it, I take away the view that the term mixed methods might be a misnomer. There's not mixture of methods, really. There's a variation in the kinds of data inputs you use to arrive at a conclusion. And there's a fairly standard toolbox of methods that are used for the analysis. And much of the variation I've heard yesterday and today is not about methods so much as what the kinds of data one uses as inputs into these methods. The other thing I take away from it is that it is not so much novelty in methods, evolving methods. There's a lot of novelty in the data we collect and novelty in the interventions that we apply, and not so much novelty in the methods in evaluation science. I must confess that I need to read more about the realist approach to evaluation. I was brought up to believe that we should avoid the sort of Cartesian reductionism and believe that there are many inputs into a final outcome. In biology, this is what we say, that we are not like the physicists that determine that if you do this, this will happen, or if you hold a pen, it will drop. We are not like that, and we've learned to believe that there are many different inputs and many different possibilities of why some particular intervention works. I confess that I would like to discuss over coffee your concern about definition of knowledge judged by assessing the processes and assumptions by which it is produced. I would have some difficulty with that in epistemological terms, but I grew up as a Popperian, so I have a different view of knowledge and what knowledge does. But I'm not going to get into that now. I'd like to thank you all very much. And I take away the view that I appreciate the effort you put into speaking to us. I must learn a bit more about realists. I know Emanuela very well, and I appreciate her frankness in saying that she would really love to be out of a job and not have a lot of statistical analysis. I must tell you a story. Hans Krebs was a famous, got the Nobel Prize, and he said in his lab, statistics is damn foolishness. If I have 12 cups, he was doing an analysis of rat slice. If I have 12 cups that show one effect and 12 cups that don't show an effect, why do I need statistics to determine that the effect is present? He never used statistics in his analysis, and he still got the Nobel Prize. But thank you all very much indeed.